Megan Doran, and I am your Virginia MRC COVID-19 coordinator. So that being said, we can go to the next slide, please. So what will you learn today? After this session, you should have a good understanding of things like state and local dispensing systems, point of dispensing operation structures, review of COVID-19 vaccination distribution, and then also some of the roles that volunteers play in medical countermeasure operations. So next slide, please. All right, so with that, I'm going to share a video now, again, like I said, for Marshall Vote. So give me just one moment to pull that up for you, and I hope you all enjoy. Thank you.
Today, and thank you for letting me talk to you a little bit about what you are going to be helping to volunteer with, and we appreciate you helping to volunteer with this massive vaccination effort that Virginia is undertaking for COVID-19. My name is Marshall Vogt. I'm an epidemiologist with the Virginia Department of Health Division of Immunization, and I'm the operations lead for COVID-19 vaccination within the COVID-19 vaccination unit here at VDH. So we've been working very diligently over the past few months to plan for the arrival of vaccine in Virginia, as well as to plan how to get vaccine out to local health departments, to hospitals and healthcare systems, and to other providers, and to get that vaccine into people's arms. And again, you as MRC volunteers are critical components of our vaccination campaign. And so again, I thank you for all of the work that you're willing to do and all of the work that you will do as we take on this mammoth task. As you can imagine, vaccinating people is something that we do every day in public health, but to vaccinate so many people in such a short period of time poses a lot of logistical challenges. We know that there are several delivery methods that we can use for COVID-19 vaccine, and so we're trying to take advantage and continue to update our plans and revise our operational
Megan, please make sure your speaker's not on.
And those are hospitals and healthcare systems, pharmacies, private providers, local health departments, and then mass vaccination clinics, sites where we could have a large number of people come while still respecting social distancing, of course, and receive a vaccine. And what's complicated about this is that it's a lot different from how we've done mass vaccination, say, for flu clinics or even during the H1N1 pandemic. One, we know that COVID cases are continuing to surge across the state, and so it makes it very difficult to deliver vaccine when we already have a very stressed healthcare system, and many of the people that would be delivering vaccine are healthcare providers that are helping to take care of COVID-19 patients. In addition, the two leading vaccine candidates that we have right now require 2 doses, and they can't be interchanged, which means that not only do we have to get people to come to us once for a vaccine, we have to get them to come back within the right period of time and get the same kind of vaccine product again. And of course, it's very difficult to get a large number of people together and administer a vaccine when we know that COVID spreads very easily, especially in closed environments where people are not able to socially distance from one another. There's lots of challenges for the COVID-19 vaccination program, but we know that it really is the key to ending the pandemic, and we're committed to working together to get vaccine to Virginians and people across the United States and across the world in order to stop this pandemic. You've probably heard about a couple of the vaccines that are being used for COVID-19 vaccination. Right now in Virginia, we're using 2 vaccines, one made by Pfizer and one made by Moderna. They're very similar vaccines in terms of their mechanism of action, but they differ a little bit in terms of their storage and handling and dosing and spacing. But they all use what's called mRNA technology. mRNA stands for messenger RNA, and it's something that basically tells our bodies how to make specific proteins. Think of it as almost a stack of copy paper in your body, and your body reads that and it prints out proteins based on what the mRNA says. We do this every day in our cells and our bodies, but the vaccine takes advantage of this technology by actually telling our bodies to produce certain proteins from the COVID-19 vaccine. So when you receive the COVID-19 vaccine, your cells receive a small piece of messenger RNA that codes for the spike protein on the outside of the COVID-19 virus. Our body's cells take in that RNA and then they produce that protein and release it out into our bodies, where our immune system mounts an immune response to it. It works on the same principles as many other vaccines. It's just that our bodies produce the antigen, that protein that stimulates the immune response, internally instead of pre-prepared antigen being injected into us. These vaccines are safe and they are effective. They've gone through the same amount of rigorous research and clinical trials that all other vaccines go through. It's just we were manufacturing them at the same time, so that once those research studies ended and we knew that the vaccines were safe and effective and they were authorized for use, they were already manufactured and ready to start being released, distributed, and administered. mRNA vaccines are not going to alter your DNA, and really the only adverse side effects that have been reported are symptoms that typically occur when your immune system is working and responding to something and trying to build an immune response. That might be fever and fatigue, sometimes achiness or soreness at the injection site, but these are very minimal symptoms. They don't last very long, and they're really a sign, again, that the vaccine is working. And more importantly, it's worth just a couple days of feeling fatigued or having a sore arm as opposed to taking the risk of getting COVID and becoming seriously ill. We know that these vaccines are the best way to beat the pandemic, and we're excited to start getting them out to people. Now, as I mentioned, there's a lot of people that need to receive vaccine, and we don't have tons and tons of vaccine yet because we're still manufacturing it. So we really had to think about how to prioritize who gets vaccine when and why they need to get vaccine. The federal government, Operation Warp Speed, the Advisory Committee for Immunization Practices at the CDC, they met and determined some phases and different criteria for people to be able to receive the vaccine. The phase 1A, or the very early vaccine recipients, include healthcare workers, those that are on the front lines of the COVID-19 fight, as well as those that live in long-term care facilities like assisted living facilities and nursing homes. That's because those individuals are very vulnerable to COVID-19 and poor health outcomes, including, unfortunately, death due to COVID-19. Phase 1A individuals have been receiving vaccine for the past couple weeks. And in fact, some individuals are already getting their second doses, meaning that they're fully immunized against COVID-19. And we're excited about that, but we know that there's more work to do. The next phase, or phase 1B, will include individuals that are 65 years and older, frontline essential workers, and those age 16 to 64 with underlying medical conditions. That's because this next group really comprises a group that can be at risk, like those that are 65 plus or with underlying health conditions for adverse health outcomes due to COVID-19, or folks like essential workers that are constantly exposed to COVID-19 because they can't work from home or really practice social distancing. We're working right now to refine our plans because the phase 1B priority group was changed a little bit from what it was originally, with the addition of people with underlying health conditions and the expansion of that age from 75 plus to 65 plus. As more vaccine becomes available, we're getting it out to more providers. Remember, initial vaccine really took place, or vaccination really took place at hospitals and local health departments. But now we're starting to see other healthcare providers being able to receive vaccine, as well as pharmacies receiving vaccine. And in fact, many of those pharmacies are the ones that went in and vaccinated people in these long-term care facilities. So as we get more vaccine out, and we're looking at those different avenues for vaccine administration, like pharmacies, like these mass vaccination sites, soon we'll be able to really ramp up the number of vaccinations that are being given here in Virginia. We've set a lofty goal of about 25,000 per day by early February, and we know that we want to scale up even more to about 50,000 vaccines per day. In order to do that, we're going to need more vaccines, more sites for people to go get a vaccine, and volunteers such as yourself to help augment our public health provider force in the community. Once we're well into phase 1B, we'll start to look at the next phase, which is 1C, other essential workers. Folks that keep our country working. They keep the lights on, they keep our infrastructure working, but they're able to maybe work from home or socially distance a little bit more, so there's less of a risk for them being exposed to COVID-19. Those folks are in the next phase, what I said was that 1C phase, and we're going to be turning our attention to them as soon as we're able to. After that, we'll start to open up the vaccine to others in the population who are interested in getting it. It's not going to be mandatory here in Virginia, nor is it likely that the vaccine will be mandated anywhere in the United States by the government. We need people to trust the vaccine, trust that it works, and feel safe that they're getting the vaccine and confident in that it's going to help end this pandemic. You are ambassadors as our MRC volunteers and can help answer questions and allay concerns. And we're excited that you're here to help us do that. Thank you so much again for volunteering and for learning so much about this vaccine so quickly and how we're going to administer it to folks in order to get out into the field and start vaccinating people. We appreciate your help, and we couldn't do it without you. Thanks so much. Be safe and be healthy.
So again, we really appreciate those words from Marshall. He's one of our really great public health communicators. And once we pull our slide deck back up, Lean is going to take us away with the point of dispensing overview. So Lean Abdelaziz, our COVID-19 medical surge coordinator, is going to lead us on from here. So Lean, take it away.
Thank you, Megan. Good morning, everyone. Thank you so much for joining us and taking this time away from your Saturday morning. Today, I'll talk a little bit about what we call it point of dispensing. So I'm just going to give you an overview about point of dispensing. Next. So what we're going to learn in the next few slides, first, we're going to understand what we mean when we say public health emergencies. And those public health emergencies, we want to know which one that we need to activate or require POD activations. We're also going to describe the types, the purpose, and the functions of point of dispensing, which is, we call it POD. We're also going to talk about the operation, the functional, the different groups and roles and responsibilities. Next. All right, so what do we mean by saying responding to a public health emergency? Our definition to a public health emergency, when we respond to it, we say it's the ability to provide medical countermeasures in support of treatment or prophylaxis to identified population in accordance with the public health guidelines and or recommendations. So we normally, public health emergency could be a small an emergency in a locality that only a certain group that has been identified or in risk. But you know, with the COVID-19 is a little bit different because everybody is being identified as they need the countermeasures or prophylaxis. So this emergency is a little bit different than the normal emergencies that we respond to. Next. So these are some of the dispensing scenarios that we normally activate our point of dispensing. So we have the public health, what we call it public health events. These are normally natural. So we have some natural occurring diseases. Sometimes we have novel or emerging infection disease like the corona, the COVID-19. And sometimes we have man-made incidents as well, like the bioterror attacks that we, if you guys remember back in 2001, 2002, when some big large cities that were receiving anthrax letters. So these also, we call them public health emergencies, but they're a little bit smaller in a smaller scale. Sometimes also natural, like wildfires, hurricanes, snowstorms, any disaster that affect the public, we call it a public in general, we call it a public health emergency, and we normally activate our point of dispensing to make sure that the public are safe. Next. All right, so these are public health emergencies that require point of dispensing. We understand some of these diseases are not in the public right now, but we know that it could be done in the lab. So these are required by the federal government for all states and localities to be ready and planned for. So we have the anthrax, we have the plague, we have the smallpox, and we have pandemic in general or emerging infectious diseases like H1N1 and the COVID-19 recently. All right, so this is just a slide that tells you a response timeline. We're normally required by the federal government to have 48 hours to be ready. So if we know there is a an outbreak or there is an incident occurs at the local level, we have 48 hours from the time that we get notified from the localities that there is an emergency to the time that we open one or multiple point of dispensing. So that's all. It depends on the scenario and the public health emergency. Next. So All emergencies, we say that start at the local level. So normally the health director of that locality is the one responsible for activating those pods. So we call them also a public health incident commander at the local level. So their responsibility is initiate the unified command. They're responsible also to request support from any cooperating agencies within locality or at the state level. And the state level normally requests the support from the federal level. Also, the health director is responsible to determine the dispensing protocol. In the next few slides, I'll tell you guys about the different dispensing protocols that we have here at the Virginia Department of Health. Next. So what's a pod? We've been saying pod, point of dispensing. A point of dispensing, it's actually a fixed identified public facility where we have our medical countermeasures there that we will be giving it to the public in response to a public health threat or emergency. So those point of dispensing, we don't just the day of the emergency we try to find it out. No, these plans have been in place for years and years. We know exactly where to go when we activate. The health department knows they have those plans already in place. So once we say activate or the health director say activate, we know where to go. We know where these partners are, so we can activate the point of dispensing. The primary goal of a point of dispensing, the pod, is triage and Medicaid, and then the secondary behavioral health and record keeping. We actually, the big picture of the pod, we want to decrease the number of individuals who might get sick. So we're not there to treat people who are sick. The people who are sick, they know where to go. This is where we want to make sure those individuals who've been exposed don't get sick. So this is the main purpose of a point of dispensing. Next. So what's the difference between a point of dispensing and a regular clinic or clinics? The clinics, as you guys all know, you go through they go through your medical history, they take your vials, they have exams, they have records, and it's very individual focused. You go in with a particular problem or an issue that you get the care just customized for you, and it's time consuming. It takes some time until you schedule your appointment, you go in, and it's a process. And then they normally, if they transfer you, normally it's in a traditional healthcare setting, meaning it's a hospital, clinic, or urgent care setting. And you normally been seen also by a medical professional, either a doctor, a nurse, somebody with a license. The pods are a little bit different. There is no exam and it's very limited records. I'm sure a lot of you already been to a pod and you get your vaccine. You can see there, we don't ask for a lot of medical records. It's a very straightforward. There is a form that you fill out, just ask basic questions, and it's a population focus. We want to get as many people vaccinated, or we want to get them the pills as many people as we could, because we want to save as many people as we could. And we process the client or very quickly, so we can get, as I said, as many people. And it's normally in a community-based. And you've seen it, if some of you have been to a pod or taken their vaccine, it's normally, it's setting in a non-traditional healthcare setting, either in a high school, in a church, in a parking lot, in a gym, in a local health department. It depends. We have so many different point of dispensing sites within the state of Virginia. And we normally reach out to you guys, volunteers, so they can help us. It depends. We have some medical and non-medical pod. With the vaccine, it's definitely a medical, because not anybody can give the vaccine. Normally, when we give pills, antibiotics, we call that a non-medical pod, because we don't need a doctor or a nurse or somebody with a license to give the pills. Next. So as I said, we have two different pods. We have what we call it non-medical model, which is we give an oral antibiotics. There's no medical license required. Any volunteers can help and work there. And we dispense it to the head of the household, meaning somebody from that household, they can come in and say, for example, I have 3 people in the household. We give them the pills for 3 people. They don't need to call all of them to come into the pod. As you can tell, the medical pod, it's a vaccine. We need people to come in so we can give them their injection. So we require the medical license. Not anybody can give the vaccine. You're going to learn later on in this presentation who can give the vaccine. And then each member of the household, as you can tell, they have to present at the pod so they can get the vaccine. Next. So what's the difference between, I'm going to tell you a little bit about the roles of the state, where we mean the Virginia Department of Health, and localities health departments. There's so many roles and responsibility, but I'm just going to cover a few of those roles. So the state, the Virginia Department of Health, normally receive the antibiotics or the vaccine, whatever the medical countermeasures, we receive it at the state level. We unpack it because it comes in a very big bulk. We unpack it, we store it, and we make sure it's secure. We secure it in our own secure warehouses throughout the state of Virginia, and then we distribute to localities, local jurisdiction, and other state governments. We're also responsible for public information and communication. You guys have seen since the corona, we do a lot of press release, we do a lot of messaging to the community. So this is also part of the Virginia Department of Health roles and responsibilities. There's so many other things that we do behind doors, training, making sure the plans are ready. There's so many things that the state does at the behind doors before those outbreaks or emergencies. Locality, they normally receive, they secure and dispense the necessary medical countermeasures to the public. MCM, it's medical countermeasures to the public in a timely and efficient manner. And they're also responsible for public information and communication. If you can tell the main difference between the state and locality, at the state level, we distribute the medication or the vaccine. At the locality is the one responsible for dispensing either the medication or the vaccine. So at the state level, we don't dispense. We leave that up to the locality, different localities within the state of Virginia to dispense. Next. So some of the policies that we have during when we have a POD operation, we normally, as I said, we don't ask for photo ID, especially if we're giving pills. For vaccine, we ask because we need the information, especially there's a second dose. So we need all the information. So we ask for ID with the vaccine operation. We ask you for full name, we ask date of birth, phone numbers, address, and basic allergy information these are the information that basically we collect. For the media policy, we normally don't allow media, or we don't allow a lot of media folks to be inside those facilities. It's very limited, and we normally ask them to follow rules. And if they make any, because we want the pod to go as smooth as possible, we don't want no media to disturb that. If they have questions, they can step outside, we can answer those questions. And we normally have a media person on site. Most of those localities, they have a media person that they can answer questions to the media. So we ask volunteers not to get involved with anybody with the media and leave that to the proper person to do that. Next. So this is a question for you guys to get you thinking. What do you think the difference between, now you understand what a pod is, what do we mean when we say a closed pod and an open pod? You can answer just throw any answers in the chat box. I'll give you guys a minute or so.
So Lean, so far in the chat, we have closed needs special invite, open is for all, and then non-public versus public. So that, and then appointment versus walk-in, etc.
These are all correct. You can go next slide, explain it more to you guys. So you guys are correct. The closed or private pod, sometimes you call it closed, sometimes you call it private. They use normally the resource of the partner organization to set up the pod and dispense the medical countermeasure in their own facilities. Or like right now, when we have like, for example, in Northern Virginia, we have a private partner with Innova Healthcare. If you guys live in the Northern Virginia and you've taken your vaccine, you probably went to one of those closed pod. If you're over the age of 65 or you're one of those certain groups. So those private, as you guys said, it's by appointment only. We normally have it in a very close setting. It's it's only for those certain population, like the phases that is required right now to go. So you cannot just walk into those closed spots. You can not just walk in and ask to be vaccinated or giving your pills. You have to have an appointment in order to get in. Another example of a closed spot, we have some partner or some agreements with some big companies or even with the government. Like, for example, we have partners with the military base throughout the state of Virginia. We send them their vaccines, we send them their medications, and they can go ahead and dispense it to their own people within that base. Also, for example, we have some agreements with Dominion Power. We send them their vaccine because we think these are essential personnel. We send them their vaccine so they can go ahead and vaccinate their own people. Also with the hospitals, we send the hospitals their own vaccines. They tell us how much they want and we send it to them and they vaccinate their own people within that hospital, within that healthcare setting. So these are examples of closed pod. Also where you guys see these days that you need an appointment to go in if you're over the age of 65 or you have issues, you're one of those people who's been characterized, you can go to those closed pod and get your vaccine. So this is what we mean by closed point of dispensing. Open point of dispensing, as you guys said, it's open to everyone. There is no restriction. Anybody can go in and is is located in a very identified community-based facility, meaning it's going to be probably in a gym, in a parking lot, in a community center, in a university, in a community college by. So these places, once they're open, you're going to hear about it because we're going to announce it everywhere to the public. So they can come in and get their vaccine. This is probably the next phase for the COVID-19. We're going to open it to the all. You can go next. All right, so these are examples of closed pod and open pods. As I said, government, for example, we call them closed pod, like Department of Social Services, for example. They say, hey, we have certain essential personnel, we need certain doses, can you send it to us? We send it to them. We have also jails, correction facilities, mental health care facilities. I mean, all these facilities, we consider them closed pod because we give them their vaccine, they take care of their own people. Sometimes they reach out to us so we can help them maybe plan, we can help them how they can set up those facilities, I mean, those point of dispensing, but they only take care of their own people. And then private hospitals, we have big churches that they ask if we can send them their vaccine so they can give it to their own people. And as I said, other companies as well. The open pod, examples, public schools, we already have agreements with most public schools, so we can have them as open pod once we decide to open it to all the public community centers. We also have drive-through. Probably you guys seen some of those drive-through point of dispensing. And then we also have mass vaccination clinics. We have some plans with some big clinics that they're gonna play as mass vaccination clinic once we open it to the public. And we also use the pharmacies. As Marshall said early, we already have those pharmacies. They've been going to long-term care facilities to give the vaccine to their people, but also we're going to have those pharmacies open to the public so they can get their vaccine as well. Next. All right, so the pod operation, as I said early, the primary goal is triage, medicate, and educate. We start by greeting and screening people at the front. We also give them a form that they can fill out, or they can fill it out by somebody there will be filling out that form for them. And then we either dispense the medication or we vaccinate the person there. Next. So I'm going to go over the different position within a pod. So we're going to start with the pod command staff. The command staff, they manage, or if it's a one person, they manage, they coordinate and consult an overall MCM side, that from the operation, liaisoning, public information, the security, the safety, the planning, the logistic, and all the administration stuff. So that particular person or people will be probably reporting to the emergency planner or the health director. Remember, the health director was the head of the operation. So everybody will eventually report to the health director of that locality. So the command staff, the responsibility, as I said earlier, direct all dispensing operation. They coordinate with partner agencies at the pod side. For example, if we're using a school, they're probably in touch with the school administrator, they're in touch with the Department of Education. They coordinate all the different logistics with the different partners within the site or outside the site. They communicate directly, what we call it with the HDOC, which is the Health Department Operations Center, or the EOC. The EOC is the Emergency Operations Center at the state level. You know, the Emergency Operations Center has been activated since last March of last year. So there's a staff 24 hours there to answer any question in terms of logistic, or if there's any issues in the field, they're there to help localities. And also the Health Department Emergency Operations Center has been activated since last year. So all hands on deck. If anybody needs help from the field, they reach out directly to those emergency operations centers. They also act as a resource for the pod staff. So if you need any help or you have any issue, you go to one of those command staff. They manage small incidents that occur during the dispensing operations. So if there's any issue in terms of safety, in terms of logistic, there's a media person outside, there's somebody disturbing, there's a medical emergency, they're the one there that they can handle those small incidents and make sure that everything is going smoothly during the operation. They also ensure the safety of everybody there, the clients and the staff, and you guys as well. We want to make sure safety is our number one in pod. If there is any breach of safety, we normally deactivate that operation or cancel that operation if there's a safety issue. Next. So within the command staff, there's a position, it's called the safety officer or a biosafety officer. I just want to mention, you guys, that those names can change from place to place. So sometimes you go into a pod, the names might be a little bit different. So don't get confused. Their roles and responsibility are similar, but the name might be a little bit different, but the roles and responsibility are the same. So in some places, you'll find a safety officer. In some places, you find a safety and a biosafety officer. So their responsibility are monitor the clinic operations and advise the clinic point of dispensing supervisors in all matters that related to safety. That could include the health and safety of the clinical personnel, also the clients who are coming in, and they also assess and anticipate any hazard or any unsafe situation. They normally look for any sign that there's something going wrong or it's an unsafe situation. It could be just a mat that is not, that people might fail or whatever it is. So they're there to kind of check on those things. Some of you guys might play that role. There might be a safety officer. You might have some clinical background. They could be a biosafety officer. You sit on the side and that you can monitor those folks after they get the vaccine. This is also a responsibility of the biosafety officer. That person or those people will probably report to either the pod manager or a clinical supervisor. Next. You can go next. All right, so we go into the unit leaders or supervisors. Each unit will have what we call it the unit leader, or we call it the unit supervisor. As I said, the names might be a little bit different, but roles and responsibilities are the same. So the unit leader or unit supervisor responsibility will be the safety. As I said, safety is number one, the safety and welfare of the staff. They oversee that operation in that particular unit. They also give briefings. So when you guys coming, if you're with the logistic team, for example, that particular unit leader, that unit supervisor, logistic supervisor will give you a briefing. They'll let you know if there's any updates. They'll tell you your roles and what you expect during that shift. They also make sure that the staff are receiving adequate breaks or rest. They look for any PPP exhaustion, meaning if you're wearing a mask for a long time and they feel like you've been exhausted or tired or you need a break, they look into those things so they can give you that you have the enough break. And if you need to have lunch or just step outside for a little bit, they make sure that you're taking the enough breaks. And they also record your time. We want to make sure that you record all the time that you've been giving to this operation. Next. So this is just a little bit of visual that you guys can see. So on the top, that's the pod manager, and then there's a safety officer or biosafety officer. Sometimes, as I said, it could be one person doing both. Depends on the size of the pod. We have a pod that could be 100 people coming in that day. We have some pods that have 5,000 people during that day. So it depends on the pod and the size of the pod. It could be one safety officer, it could be 10 safety officer. It could be one safety officer who's handling just the safety in general, and it could be a biosafety officer who handling checking on people, making sure they're doing okay after the vaccine. And then there's a public information officer. The public information officer is normally a person within the health department. They've been trained, they know how to talk to the media, they have their talking points, and that's normally not a volunteer position. But a pod manager could be a volunteer, a safety officer could be a volunteer, a biosafety officer could be a volunteer. These all, we call them command staff. As I said earlier, these are the command staff. And then you can see at the bottom, these are the unit leaders or supervisors. You can see the different examples. This chart can expand to be, like a huge chart, or it could be a smaller chart. All it depends on the pod size. We called it the ICS structure, which is Incident Command System Structure. This is what we use when we manage and plan for our pod operation. Next. So now we're going to the COVID Vaccinator. It's a very straightforward. They prepare and administer vaccine to the clinic. These are the main roles. That person or those people will be reporting to the pod manager or their unit leader if they have a unit leader, or the clinical supervisor. As I said, names doesn't make any huge difference as long as they know their roles and responsibility. And once you get in, they will tell you, this is your unit leader, this is your clinical supervisor, this is your pod manager, so you'll know who you report to if you have any issues or you have any questions. Next. We also have what we call the Vaccinator or support or a medical evaluator. These are two different positions. Sometimes could be one person in each position. Sometimes could be multiple people in each position. Those folks, they ensure the clients receive the proper screening. There's a form, there's certain questions. They want to make sure that those clients answer the questions and they receive the proper screening. They also do the medical evaluation pre-protocols. And then they collect and process all patient registration and evaluation forms. They record the time in and out once you get into the pod and once you leave, because there is a observation period after each vaccine. So they want to make sure that the clients has been there enough and is been did their medical evaluation pre-protocols. And they also, that person particularly, or those people will report to the pod manager, or if they have a unit leader or a clinical supervisor. Next. You can see where they're sitting, the clinical supervisor. We call them vaccinators. You can see them there, or vaccinator assistants. And then there's also the medical evaluation. I have some comments here. They said the screens keep freezing, so I'm not really sure if that's a problem with everybody or just one person. Do you guys see the screen? So there's a participant question. I want you guys to think of a role or roles in a pod mission, a support role. So we'll learn a little bit about the vaccinators. We learned about the medical evaluation. Now, if you guys want to throw some examples of people who can support or different roles to support to the pod mission.
Yeah, and I wanted to reach out to Yvonne. It looks like she was maybe having some issues. If you're having trouble seeing the slides, try clicking the view button on the top right-hand corner of the screen, and that can show you whether to swap, to the speakers or the gallery, standard, etc. And I recommend the standard format, which you should be able to see. So just to switch back to Lean's question though, for the roles in the pod, it looks like we have some observation, paperwork, greeter, and then it says observation after vaccination. Any other thoughts? Feel free to stick them in the chat. Those are some good ones though. Flow control, giving directions, traffic control, drawing up vaccine into syringe, security and safety, site flow, IT, logistics, translators. Those are some great ones.
Yeah. Definitely. You can go next. These are all correct. We have so many different support roles that you can guys play and support us. It doesn't have to, you don't have to have a clinical background to play in those roles or participate in those roles. So as some of you mentioned, we have the logistic support, that unit responsible for organizing, directing, and coordinating the operation associated with the occurring and maintaining the facility, the personnel, the equipment, and the support, the point of dispensing logistic operation overall. It could be they support the food, they make sure that everything is there before the pod operation starts. So the logistic people, they play a critical role in making sure the operation goes smooth. Those people will be probably reporting to the logistic unit leader if you have one. If you don't have a logistic unit leader, might be a logistic supervisor Or if you don't have either one, you might have just, if it's a small pod, you might be just, that logistic person might be reporting directly to the pod manager. Next. So you can see where they're sitting, the logistic. It could be it could be an IT person there. It could be a runner. So many names when it comes to logistics. Somebody can be a food, logistic person, whatever you name it. Okay. All right, then we go to the admin support. So the admin, there's so many admin support positions. We have the vaccine controller. We have what we call them fillers, screeners, assistants, floaters, you name it. We don't normally, there's so many names, so don't get caught by those names. Just if you're in admin support, you will know you're probably assigned to that admin support. The job description, they review and screen forms and assist the vaccinators by preparing a type of vaccine that is required. That particular person or people will probably be reporting directly to the pod manager or the support services unit leader or supervisor unit leader, flow traffic unit leader. It depends where you're sitting and who you can report to. Next. So the greeter and screener, as some of you mentioned, these are very important folks. They sitting by the front. They make sure to greet the clients, take your temperature and symptoms. They direct you if you're visually ill, direct you to the healthcare system. Because as I said, in the pod, we don't treat anybody who's sick or we think that they might sick. We direct them to the right place. There's normally probably an ambulance sitting there as well, just in case if there is something, somebody that needs some medical attention. They also address any needs, such as physical, cognitive, if you need assistance with language services. These are the people they normally at the front, make sure that clients get the proper, address their needs. Next. So there's what we call them the next unit. Normally, it's the form distribution or review unit. They make sure they record the time in when people get in. They hand the form so clients can fill out the form. They answer any questions. They review the form. They make sure they record the time out when the client leaves. They monitor for clients if they need any additional assistance or support. It's everybody's responsibility in the pod to see if there is a need of any clients to make sure to address it or direct them to the right person so they can address those needs. And you guys will be trained on those forms. If you work in those units, you'll have additional training to know how to fill out those forms or if the clients have any questions. The picture that you guys see, by the way, these are all volunteers with us, working in actual clinics or in point of dispensing, helping us. Next. So the flow and traffic control unit, those folks, they normally guide clients through the pod, especially if we have a drive-through pod, they play a critical role there. They direct clients with any questions. They also prevent arriving clients from entering the pod through exit doors. We like people to come in because it's a lot of people, so we want to make sure the traffic flows smoothly and people can get in from one and leave in from the other side. So they make sure these things are going accordingly and smoothly. And they also address any needs. If there is a physical, cognitive language services, whatever needs the clients have, they want to make sure to direct them to the right person to help or find them the help that they need. Next. So you can see the location of in the ICS structure. You can see the flow control supervisor or the support service supervisor. You can see them, they're greeter screener, flow inside, flow outside. It depends on the pod as well. If it's an inside pod, you're probably not going to find a traffic controller. If it's an outside pod, you probably find a traffic controller person. You can see also they might sit in under the critical supervisor, form distribution, form review. So you'll find different position. All it depends on the size of the pod. Next. So also we have the interpretation or special accommodation. These are folks, they assist non-English speaking clients, understanding the information and process them through the pod. And then they interpret information between the pod staff and clients. Some pod, they have people in the pod doing that, and some they have a phone or they have access to an interpreter outside of the pod that they can use. They also identify any accommodation is needed for vulnerable population. If there is, in the vaccine, we don't have children, but In other situation, if there's a children, they'll be there to help as well. Elder, access and function needs, hearing and visual impairment. So if there's any issue and any needs, just please direct those clients to the right person so we can make sure they get the help that they need. That particular person or people will be reporting to the support service unit leader, or they might be reported directly to a pod manager. Next. So you can see where they're sitting. I like to give you guys those visuals so you can kind of picture where everybody's sitting within the ICS structure. Next. All right, so we come into the end. This is just, I give you guys an overview of all the different roles and responsibility. The names might be different. You might be doing multiple things. You might start by a greeter, and by the end of the day, you might be doing other things inside the pod. So just be flexible and adaptable. And there's normally a briefing at the beginning of each shift. They will tell you exactly what your roles and responsibility. And if you have questions, if you want to know where you're going to be putting, within one team, you can reach out to your unit coordinator at the local level. They will let you know, the MRC unit coordinator, they'll let you know what role you've been assigned to. You probably get sometimes you get an email also tell you exactly what position or what type of role you're going to be playing in a pod. So if you have a question, always reach out to your unit, MRC unit coordinator at the local level. So we come into a pod demobilization. What do we mean by that? This is meaning either the pod operation is ended. So for example, we said it's going to start at 8 in the morning and it ends by 5. This is the time to demobilize, or a safety issue happened and the pod manager decided to end the operation. This is also, we call it a pod demobilization. So at the conclusion of any pod operation, the pod manager will make sure to secure what we call the strategic national stockpile, or the MCM inventory. The strategic national stockpile is the stockpile that we normally get with the different things that we need at the state or local level from the federal government. And the MCM inventory, they also notified all team leaders. This is time to demobilize. Then the team leaders will hold a debriefing with each their units or their teams. And they do what we call it a hot wash. The hot wash with their team, they discuss in those hot wash the success, what happened during that day, and also any areas of improvement. So if you guys feel free to speak up. If you see something that is done right, or something that has been a success, please let them know during this hot wash. Speak up and let the team unit or supervisor knows that, hey, this is something that I've seen today. It was very successful, the way that we've been handling people, the traffic, whatever you see that is area of success, please let them know, because we want to continue doing those success things. We want to continue get better as well. So if you see an area of an improvement, we like to call them area of improvement. We don't like to call them failures, because we're always there to improve our roles and improve the way we do things. So if you see something that it can be done better, then you come in and speak up. The hot wash, it happens right after there, but after action report, that's something we write by the end of each operation. If it's a 12-hour shift or maybe a week, they will write after action report. But the hot wash, this is something happens right after the shift. Everything is still fresh in your head. You can please feel free to speak up and let the team unit leaders or the pod manager know about whatever you've seen that day. And then your roles or the general pod staff roles, you assist in demobilizing, cleaning up the area, making sure that the next pod operation, when they come in, they're ready, because normally it's back to back. So one operation ends, we normally start the second operation next day or the next 12-hour. So make sure that things are there for the next pod team when they come in. Things are clean up and ready for them to start their shift. Next. So these are some tips to participate in a pod. Be proactive. If you find a problem before it starts, please speak up. Pay attention to your staff need. If you're a unit leader, if you're a team supervisor, or just your colleagues. If you feel that somebody's exhausted or tired or need a break, be there. Speak to the unit supervisor. Let them know. Be transparent as well, and don't be afraid to get your hands there. I mean, if there's a somewhere unit that they need more help and you feel like you can help them, go ahead and step up and say, hey, if you need help, talk to your unit leader, your unit supervisor, let them know that, hey, I see, a traffic jam outside, and I step outside and help the traffic flow, folks, or whatever you feel like that there's a need feel free to do it. I mean, we're there, all of us, to help and make sure the operation goes smoothly and as quick as we want it to, and as safe as well. So safety, as I said, number one, your safety and the client's safety, it's in your hands. It's your responsibility of everybody to make sure that they're safe and the information is being provided as well. So safety consideration, you call 911 if there's a medical emergency. You provide CPR only if you're certified and you know how to do a CPR. You inform your ICS supervisor, your incident command structure supervisor, if you see anything, or your safety officer. If you feel there's some hazard outside that you were walking by and you saw it, speak to the safety officer. Ask, where's the safety officer? Let them know if you've seen an injury so they can make sure that they take care of it. Also, everybody has a role. If you see somebody who's exhausted, stressed, tired, the weather is going to get warmer, maybe hotter, people will be outside sitting for a long time. If you see somebody who's exhausted from wearing their mask or their PPE, please let the supervisor, unit leader knows, or make sure to talk to someone so they can take care of them. And at the end, if you see something, please say something. All right, I think that's all I have. I'll hang in for questions, and then I'll turn it to Megan. If there's any questions in the chat.
Yeah, so one question that came in was talking about signs of PPE exhaustion. So maybe we can kind of focus on that one for just a moment for some just basic signs of PPE exhaustion.
So for the pod, the only requirement for PPE is wearing a mask, either the surgical mask or any proper mask. So there's not an actual full PPE gown. So because of that, you don't see a lot of PPE exhausted. So people normally, when they wear those things for a long time, they either get a fatigue or tired, they have headache, or they feel a little bit drowsy. So this is the signs that we want you guys to look for. If you see somebody who's exhausted, or they start sweating, or they just tired, this is the signs. But luckily for us, the vaccine clinics, we only required masks. And mask is not that bad, you know, like people don't get exhausted if they wear it for that period of time. If it's longer, maybe than 12 hours or whatever, maybe you'll see some fatigue. That's what we mean by PPE exhausted.
Yeah, and so one thing that I will say a little bit about working in the pod itself is you will likely have people come up and ask you a lot through the day. Hey, how are you doing? Do you need to take a break, etc. And don't feel like you can't take a break. You know, we all are human. We all need to take a moment to use the restroom, to go get a drink of water. You know, working as I've worked in a couple of different pods at you know, through the COVID vaccination, sometimes as a greeter, sometimes as flow control, etc. And all of them have their own needs. So if you are a greeter and you may be sitting at a desk and greeting a lot of people, but you may need to take a moment to, you know, get some water and take a break from talking because you're sitting there talking to a lot of different people. Flow control, you know, you may need to take a moment to go have a seat because you've been standing more. So, you know, each one of the different roles may have its own needs. So there will be someone kind of coming through a lot of the time and asking you those questions. And same way with PPE, you know, exhaustion, is Lean pointed out to, you know, just kind of making sure that we're all taking care of one another is really important for the safety of the pod.
Stay hydrated, take breaks, make sure that you eat, you have your water next to you. And as somebody mentioned here, you can get exhausted from wearing a mask for a long time, you know, so make sure to take those breaks. Any other questions, Megan?
Not that I've seen so far. That was the big one. There are some questions related to the vaccine itself and the administration of the vaccine itself. I'm going to hold those a little bit because we're going to be going over those soon. And I will be sure to make sure to answer those directly in my portion. But thank you so much, Lean. Lean is very, very familiar with this topic. So, you know, we do really appreciate that. You know, really supporting what you may encounter at the individual pods, because pods have a lot of moving parts and pieces to them. So thank you so much, Lean. All right, so we're going to get into the COVID vaccination kind of updates. So next slide, please. So first and foremost, there's a lot of different variety of pod models that can be utilized. As Lean kind of mentioned before, pods are in different locations. So therefore, they have to take on kind of their own variety of models. So they may be drive up, they may be walk up. You may have them in government centers, you may have them in church buildings or other community centers, etc. So the Medical Reserve Corps, of course, has played an extremely valuable role in the vaccination efforts for COVID-19 administration and distribution. If this were to be a different kind of mass medical countermeasure, we would still be serving in these roles. It may look a little different the next time around, but the MRC was really designed to be able to assist with this specific type of mission. So working in a variety of public places, as I mentioned, it may be in community centers, places of work, etc. And then also you may be working with a variety of populations. So some things to consider when we talk about that: language differences, different abilities, and then also the accommodations that go with that. So I wanted to kind of highlight this because this was something new that has come up recently, especially as we've had more and more pods. Just making sure that you understand that not everyone has the same level of literacy, for example. So if there's maybe information about a vaccination, someone may need some assistance with reading, and just looking at different ways that we can manage those situations to make sure that the person that we're working with from the population feels very respected and appreciated. We do have interpreters there for language differences, and people with different abilities are welcome to come to these pods as well. So just looking at ways that we can make sure that everyone feels comfortable as much as possible when they arrive at the pod, because this is a whole community approach that we're dealing with. So next slide, please. So just wanted to kind of highlight the different types of vaccines that are in development. This was updated not too terribly long ago, but has probably been updated since then quite a bit. So just wanted to make sure that everyone knew which type of COVID vaccine that we are working with right now. The primary one that we are looking at working with through the Johnson & Johnson, Moderna, and Pfizer are the nucleic form. So that's the primary form that we've been utilizing. This is from the WHO, but as you can see, there's even more vaccines that are being used throughout other countries throughout the world, and that are also still in phase 1 through 3 trials as well for COVID-19. So next slide, please. So a little bit of differences between the Pfizer, Moderna, and Johnson & Johnson. You may know some of this already. It might be a little repetitive for you, but I want to make sure that I throw this out there for your awareness. So as you may know, Pfizer and Moderna are both 2-dose vaccinations delivered a little bit differently. So Pfizer has 21 days in between doses, whereas Moderna is 28 days between doses. Their efficacy is pretty similar in that 94 plus percentile range. And then also the potential side effects are fairly similar between both. With Moderna, it turns out seeming to have a little bit more potential side effects in terms of muscle aches, in addition to some of those that Pfizer has. Also, Johnson & Johnson is probably our newest one on the block, so to speak. So this is a one-dose vaccination currently. There are some studies being done for having a secondary dose of Johnson & Johnson to see if that would increase the efficacy even beyond the 85%. But all three of these, as Marshall mentioned earlier in our discussion, really are great at preventing severe illness and have fairly minimal side effects for the amount of efficacy that they produce. These are, just generally, to speak generally, many vaccines that we use, such as the flu vaccine, have less efficacy than these types of vaccines. So it really is just an amazing thing that we were able to get such efficacious vaccines so quickly. So that being said, next slide. So as we kind of look at the distribution plan, because that's really important to us with the MRC, as we look at the CDC vaccination distribution plan here, and you can kind of see that we're still somewhat in that red circle or oval there in that phase 1, but we're eking over into phase 2. So different parts of the state have moved into phase 2. And I will say that this slide is a little bit dated, so we're really looking primarily at that curvature on the slide primarily, and not necessarily at the language at the bottom. So we are moving towards that phase 2, and we're so excited that the governor announced the other day that we're going to be moving into phase 2 as early as April 18th. As a full-on state, but some areas are already working in phase 2 right now. So if you live in one of those areas, that's wonderful, and we're so excited for you. So next slide, please. So when we look at the phases, if you happen to live in one of those areas that's still in the phase 1 area, these are the typical kind of path of the phases. So, phase 1A, which, was primarily the health personnel in the long-term care facilities, et cetera. MRC early on in the pandemic were considered part of the phase 1A category and still technically are. So if you were working on site at a POD for COVID vaccination, you would be falling into this phase 1A category and still will. Additionally, we had the phase 1B, which gets into more of age 65 plus, essential workers, people with medical conditions, et cetera. And then phase 1C, which kind of adds into more of those essential workers and tries to really target that. These were always appointment only. We're kind of migrating on. So, this presentation will probably change by next month substantially, and that's very exciting to us. So next slide, please. So some frequently asked questions that we receive are kind of what phase are MRC volunteers considered to be in. So as I mentioned before, MRC volunteers are always been considered to be in the 1A phase, as long as you were actively helping in the vaccination effort or testing effort. So that being said, if you are an MRC volunteer, but you're not necessarily deploying out, we did ask for you to wait until it was your turn to be vaccinated. But if you were working in that public sphere of, helping out with the vaccination efforts and the testing efforts, you did fall into phase 1A. For who all can be vaccinated in each phase, we just kind of talked a little bit about that. But if you have specific questions, I would recommend going to this website here. It's vdh.virginia.gov. COVID-19 vaccine / So that's where all of our good information is housed about the COVID-19 vaccine. Next slide, please. So when does phase 2 start? So phase 2 vaccination starts in some areas has already begun. And the state estimates that the Commonwealth will move into that in the month of April. So April 18th, which is not too far off, just about a week or so away. So very, very excited to be able to move into that next phase. That really speaks volumes about the good work that folks like yourself have already been able to accomplish. We could not have scaled up and vaccinated this much of the state without the help of amazing volunteers like yourself. And then is a copy of the Virginia plan that was submitted to the CDC available. And yes, if you would like to see more about this plan and the plan for vaccination overall, you can gather that here. I will mention that these slides will be available online for you guys to go back to. So if you have any specific questions or need to review back over these, you can. Next slide, please. So another question that we get often is how this is being documented. So we use a variety of different systems at this point. We use VAMs, we use different systems that allow us to put in information, and then it connects over to our VIS system, so our Virginia immunization system, and that allows us to make sure that these are all documented. And that's really, once it's into the VIS system, that's really how the CDC tracks how many people have been vaccinated throughout the country as well. So when you're watching the news or you're reading about how many vaccinations have been given, that's part of that network of computer systems, is making sure that that all goes into our VIS system. Then we talked a little bit about this earlier, but whether or not pod locations are already determined, and once they'll take place, what that timeline looks like. So pod locations have been being determined for a long, long time. So many of our large pod locations have been, under careful consideration for years, frankly. We want to make sure that we plan accordingly. And so they are planned. Because COVID is such a massive effort of vaccination, we've added additional locations where pods could take place throughout the emergency as well. So we've added even more to that. So when we talk about some of our community vaccination centers that may be being held with FEMA and other resources as well, those have been planned throughout the emergency as well, in addition to what was already previously planned. Those locations are, of course, not necessarily open to the public, just depending on if they are by appointment only still, due to the phase 1, A, B, and C groupings, depending on the area. But as we go into phase 2, those will be publicly available, and we will be able to let any and everyone over the age of 16 come to those and get vaccinated. So that's really extremely exciting. So next slide, please. And then just a little bit of conversation about immunization itself and kind of what the immune response looks like. So just a reminder that the immune response begins at the point of injection. So your body starts to, develop immunity at that point, but it takes about 2 weeks for the full efficacy to take effect of each one of the doses. So for example, with the Pfizer vaccine, given that it's 21 days apart and it's 2 doses, you would have kind of the full efficacy that the vaccine was going to be providing to you 2 weeks out from your second dose. Same way for Moderna and Johnson & Johnson. Moderna after the second dose, 2 weeks out after that one. Johnson & Johnson, since it's 1 dose, it would be, you would have your full efficacy of the vaccine 2 weeks or so after that one. Immunity is one of those things that builds over time. So you may be more or less immune anytime on kind of that stretch of timeline. And then who can vaccinate? So this was a really important question that someone asked in the chat earlier. So I want to make sure that I am very clear about this. So we do have a few different paths for our vaccinators, and recent legislation such as the PrEP Act on both the national level and then also on the state level, House Bill 2333 from the General Assembly, which was signed by Governor Northam, expanded out who is able to be a vaccinator. So if you are interested to know if you fall into one of those categories, there's a long list. So I did not include that here, but the link here, the vdh.virginia.gov content link here, does list out who can vaccinate under what law. That includes, for the PrEP Act, out-of-state vaccinators for, who have even had their license kind of lapse. Let's say they went into retirement, et cetera, for up to 5 years. And many for those that are in state. So nurses, doctors, all dental hygienists, dentists, et cetera, those groups can vaccinate for up to 20 years after their license has ended. So that being said, your license needs to have been unencumbered, so no issues with that license, et cetera. And then we will still require training and skills evaluation, which I'll get into shortly. But there are kind of multiple different paths if you do have that health provider license, either out of state or in state, that you may be able to vaccinate. So for more information, I highly recommend going to this individual website to get the list of who can vaccinate and under what rule. And then for traditional vaccinators, we talk a lot about traditional versus non-traditional. So traditional is kind of those folks who the CDC has said are folks that typically have vaccinated someone in the past year. So if you work in a role, let's say that you work in a provider's office as a nurse or a provider yourself, et cetera, that you typically give vaccinations, we have a very short 1 hour amount of training that's usually fairly specific to the new COVID vaccines that we would like for you to take to make sure that we are providing those vaccinations safely. If you're more in a non-traditional vaccinator, let's say you're maybe a dentist, and so you don't give vaccinations quite as often, but you're very familiar with giving injections because you're a dentist. So in that case, we ask that you take a longer list of trainings that includes, some additional things such as bloodborne pathogens, et cetera, just in addition to that. So it's still not a lot of training, but it's a little bit more than just the streamlined traditional. So we request that you take that additional training, and then everyone who vaccinates will have to have a skills evaluation. So I have the training link here. So if you find yourself to be kind of in one of those categories based off of the listing that you see above, you can certainly go and view the training there and then begin that. But do know that everyone who vaccinates has to be able to prove their skill to a skills evaluator who is a clinician. So that being said, we can move to the next slide. So if you want to know a little bit more about pods themselves, you're welcome to take this additional training. This is not required, but if you have additional questions, this is really where to go. It's our pod essential overview, and it can be found in Train, which we talked about earlier in the orientation. So you would just need the course number, which is listed here. And so you're welcome to search for that in Train as well. Next slide. So if you have any questions beyond what we're able to answer here today, we encourage you to kind of funnel those into multiple sources. So if you have general questions just about orientation or when you're going to get your badge or, et cetera, you can reach either out to your coordinator or the VA MRC at vdh.virginia.gov, and we can help walk you through questions about VBHS and alerts and, anything like that. If you have COVID-19 specific questions, those questions come to me, and you can send those to covid19@vamrc.org. And so they'll be directed to me, and I can try and answer any questions that you have specifically about the vaccine or COVID in general, or anything related specifically to COVID. Next slide, please. So I want to thank you. We're going to still take some questions, but did want to go ahead and move to the next slide so that everybody can go ahead and be verifying their attendance while we answer some questions. So similar to before in the orientation, if you were previously on, you're going to go to the vdh.virginia.gov/MRC/roll call link here. And just remember that the secret phrase is POD rocks, and you can enter that in once you've clicked on that link. So we'll be making sure that we put that into the chat, but do want to open it up to any questions that Lean's been able to get from the chat.
Sure. Thank you, Megan, so much for the great presentation. So I'll go ahead and see if there's any questions. There was still a question about the PPE requirement during a pod. So if you, Megan, you want to cover that, what exactly they need to wear and why some pods are different than other pods?
Yeah, so when you do go to a pod, we require, of course, for you to wear your badge. I see that there was a question about needing a badge beforehand. Yes, we do require that you have a badge. That's your identification. Oftentimes for the newer badges, even it has a QR code that tells, your background, so that if anybody has a question about whether you're a clinical provider, et cetera, that it's got that on your badge and they can quickly look that up. Also, we ask that you wear either your VA MRC shirt that you were given early on or your COVID-19 VA MRC shirt so that you're easily identifiable. We have a lot of different folks working at these pods right now. We have people from the MRC, which are a big part of these pods. Sometimes they fulfill 100% or so of the pod, honestly, but sometimes we also have people that are working from different sectors. I know while schools were out, for example, we had public health nurses from the school system that were working in the pods, et cetera, to fulfill any of those roles. If you're needing a badge, for example, though, I do want to just mention to reach out to your MRC coordinator. They can help facilitate getting that to you. Sometimes we have events where we have everybody just come by in their car and we hand them over their badge real quick in the car. So, feel free to do that. Any other questions?
Yes, there's more question about there's some state they said they suspended the use of Johnson & Johnson. Have we heard anything about that in Virginia? And then there's a question about the different efficacy for different vaccine. I think you covered that. But there's anything you heard about Johnson & Johnson that issues here in Virginia?
So I know Johnson & Johnson, as you may be aware from the news, there was some distribution issues with the Johnson & Johnson vaccine, which has impacted some of the Johnson & Johnson supply in Virginia specifically. So I know that was specifically an issue for the Northern Virginia area in terms of their amount of Johnson & Johnson vaccination. We do still have a lot of vaccination coming in, both Pfizer and Moderna, and still Johnson & Johnson. So at this point, we feel comfortable still saying that we're going to be able to provide enough vaccine for any and all adults over the age of 16 starting on April the 18th. So although that has been a factor, it's one that hasn't slowed us down. So we're still able to really provide a lot of vaccine. I saw that there was a question about if they could, if we would be providing masks. If you are working as a vaccinator, we provide you with the proper PPE. If you're working in other roles, we require for you to at least wear that cloth mask that's required in the state of Virginia whenever you're working or inhabiting public spaces right now. So for example, if you're going to be working as if you're going to be working as a greeter, you would need to just make sure to bring a cloth or other type of mask to work in that day. And you're welcome to double mask. You're welcome to have whatever you feel comfortable working in. But we will be providing specifically surgical masks to those who are vaccinating.
Okay. And then who determine which vaccine that can receive when they arrive to the pod?
That's a great question. So usually pods are set up with a specific type of vaccine that they plan to give that day. So it's usually what is available. And a lot of times they'll be posted out front on a partition or something so that you know which vaccine is going to be given that day. If you're one of those that's making an appointment still at this time, they'll mention in the email, etc., what type of vaccine you'll be receiving. You don't necessarily get to come in and pick from the three, but you will be notified, when you arrive, which vaccine they are giving that day.
There's a quick question because of the time. There's a lot of great questions, but I'm just gonna kind of cover real quick the one that I feel like that might be important. So there's a question from Chris. He's a registered nurse and is asking, he wants to volunteer online. When they attended the orientation early, they were told that there's some position online, but Fairfax Medical Reserve told him they don't have any positions online. What they can do?
Yeah, so what I think you've already done some of it to let them know that you're interested in virtually assisting. It depends on the health district, really what their capacity and what their needs are right now. I know that there was some availability early on for virtual, specifically in Fairfax. That may be changing, but Paula is the coordinator out there, for example. That's my home unit for when I'm volunteering, and I would just make sure to email your coordinator and let them know that you're interested in those types of opportunities, so that when they come up, they can remember that, and make sure that you're aware of those different types of opportunities when they're available.
And there's a question about the point of dispensing plans and how we do that. So actually, in all states, we follow the guidelines from CDC. So when we wrote the plan a while back, and we update those plans every year. We call it the mass dispensing plan. Those plans are followed by the CDC direction and HHS. So if you go to any state, you're going to find similar, localities a little bit different, the setup is different, but the basics and the foundation are all coming from the federal government, CDC or HHS. They tell us what to do, and they show us an example, and then based on it, we write our plans. Each state fits their plans based on their population, their needs, or whatever it is. But we have a standard that all of us follow throughout the United States. So that's to answer a question about the best practices when it comes to a pod. Can MRC volunteer travel abroad or other states? Megan, you want to answer that, or I can answer? It's up to you.
I'm assuming that question is whether or not you're going to be able to volunteer abroad or other states. To my knowledge, we don't have any abroad, possibilities right now. This is an HHS run program, which means that it's part of the United States government, and it falls under ASPR. In HHS. So the abroad question is a little bit out, but I will say that there have been opportunities where we've supported other states. So for example, during Hurricane Florence, we had volunteers that went to different states to support with that. I think a couple of them even got to ride on a helicopter, which was, kind of interesting. But yes, we do have occasional times where there's a call out for additional support from other states, and those are of course fairly rare, but do happen. And when they do happen, we make sure that you're able to support that mission for a specific amount of time and make sure that there's lodgings available and things like that. So, but those are kind of on a very specific basis, so I won't go too much into detail about that.
Yeah, we normally do that during hurricanes or big emergencies. It's state by state compact, so there's agreements, how many volunteers we can send, and there's a lot of logistics. So it's a very complicated process, but you can be deployed to other states. But right now, everybody's helping in all states. So, but sometimes we do it during big emergencies. Somebody asking, he's a medical international graduate. They don't have a license here, but they like to participate in volunteering.
Well, we so welcome you to volunteering. And I want to make sure that everybody is aware that we understand that there's different legalities involved with all of that. But we still, can find use for you as a volunteer. You may be working in an area that's non-clinical just based on that license status. And then, as that changes, as you're able to secure that license in the United States, and specifically in Virginia or where have you, make sure to update that on your profile and reach out to us, and we can make sure to update that so that we kind of change you over to that medical role. But in the meantime, as we've talked about before, there are so many areas that you can be useful and helpful, that please understand that we even have clinicians that choose to work in some of the other areas. For example, they may be tired, of doing the kind of the clinical roles, and they kind of want to do more of like a logistics role one day or something else. So there is no shame in working in a multitude of roles. I myself am a medical assistant, but I choose to work in general support. So, for that kind of knowledge as well.
So there's a lot of questions about badging and t-shirts. I know you cover that, but just so we can please reach out to your unit coordinator. If you have a question about your badge, about your shirt, reach out to them. They'll be able to let you know where to go and pick it up, or if they can drop it or even mail it. Some units, they mail it to you guys. And there's also a question about, okay, there is an event, you get the alert, you sign up, but you never hear back from unit coordinator. They normally send those alerts to you guys, you sign up, that doesn't mean that you're ready to be deployed. So please wait until they confirm with another email saying that you're ready to be deployed, and go ahead. Sometimes they either have enough people, or you're not done with your training, so that's why you were never been deployed. So there's a lot of things when they pick up who can be deployed. If you're interested, just reach out directly to them and let them know, hey, I've signed up to this alert and I'm really interested to come in. What's some of the things that I'm missing that I need to do so I can be able to be deployed to that particular event? So don't get frustrated. It's a process, but eventually you're going to get there. This is going to be a long shot. I mean, going to be vaccinating people probably till the end of the year. So you're always going to have a place. And there's so many different opportunities, not just helping with the vaccine. We have so many other missions that you might be able to help with if you're not comfortable to help in the pod operation.
Right. And somebody asked, how to find out who their unit coordinator was. And so since you mentioned that, Lena, I just want to let everybody know, I put the link in the chat, and it does link to how you get in touch with them via email. For each individual unit. As we talked about in our orientation before, we have about 80 or so people that are involved in MRC right now. So it may be a variety of assistants or students that are also working with MRC that reach back out to you to be able to help you, but they can all assist. So feel free to utilize that link, and we appreciate that. And then, yes, we will post the VDH roll call link as well in the chat box.
Do they need more training for medical pod roles? I think you covered that a little bit. Or non-medical, are they okay with the training today?
So for non-medical, you are able to go, really this training itself is an optional training. So this was not necessarily required, but you are welcome to utilize this to help you once you're at the pod. For medical, this will not allow you to deploy. So if you are a medical volunteer and you have not taken your additional vaccinator training, we will be contacting you and letting you know that unfortunately you cannot deploy. We do require still, as I mentioned before, that you have that vaccinator specific training, as well as that skills assessment check off as well.